BBC Radio Guernsey.
Back in April, we heard more than 800 people in the bailiwick had licences to import medicinal cannabis. While cannabis as a recreational drug is currently illegal in Guernsey, it is available here for medicinal use where it's been prescribed by a doctor. 2 clinics here specialise in cannabis-based medicines, Pura Health and Medican. They say medicinal cannabis can be used to treat a variety of conditions ranging from chronic pain to anxiety and depression. Earlier on this year, we spoke to Lineker Sprinks, who told us how she found it helpful to treat a rare joint condition.
I stopped taking any form of really strong painkillers and opiates in my mid-20s. In the last couple of years, I've tried to apply for medical cannabis and things, but the expense of it been really difficult journey. Only in the last few months, I've managed to obtain a cannabis prescription. I can do my job much better. I don't get tired as quickly. I can focus on myself and my job and not just hear my pain in my head, constantly overwhelming my all day.
But Guernsey Police now say they are seeing an increasing number of people abusing the system, using medicinal cannabis in a way that it was never intended. Here's what the Chief of Police, Rory Hardy, had to say on the subject late last month.
Medicinal cannabis or prescribed medicinal cannabis is appearing in situations for which it's not being prescribed. So there is clear evidence that medicinal cannabis is now being traded as an illegal drug, and we are seeing people who are in possession of medicinal cannabis using it against the terms and conditions in which it's been imported. So that is another area for us that is generating more work.
That's Rory Hardy there speaking to us late last month about the increasing number of people they are seeing using medicinal cannabis improperly. Well, for more on this subject, I'm joined now by Dr. Simon Erridge, Head of Research and Access at Sapphire Medical, a UK-based clinic that specialises in medicinal cannabis. Dr. Erridge, good morning and thanks for being here today.
Good morning, Tim. Thank you for having me on.
You're very welcome. Firstly, are you surprised to learn that the police are seeing more people trading medicinal cannabis or using it in a way that it wasn't intended? Or is this sort of to be expected when things like this are introduced in Guernsey?
I think with respect to that, we're surprised that it has become such an issue with respect to the police in Guernsey because with respect to people that we see at Sapphire Medical Clinics, we've only been made aware of a handful of cases across the thousands of patients that we see in Guernsey, Jersey, and also in the mainland UK. And it's obviously something that we have a no tolerance approach to because of not only the fact that of its illegalities, but also the effects that it has on legitimate medical cannabis patients and sort of sets things back with regards to them with the the stigma that they may potentially face.
Yeah, and we heard there briefly from Lineker, who found it really helpful, this medicinal cannabis. And you work with some patients in Guernsey that use your clinic's services as well. So what interactions has the clinic had with Guernsey patients? And what type of clinical issues are you seeing being used with medicinal cannabis?
Yeah, so we see a wide range of different conditions. However, I would say that there are sort of 3 predominant conditions that we see. Much like Lineker, lots of patients we see have chronic pain, some with arthritis, like she was suffering with, but also other conditions that cause chronic pain, like endometriosis, back pain, but also another really prevalent condition which we see patients for is anxiety. And then the third would be sort of post-traumatic stress disorder as well.
And sort of what checks and balances are there in the current system to ensure that prescriptions are properly issued and that patient care is monitored as well? And how easy is it to sort of get a prescription and then get the medicinal cannabis off a provider like yourself?
Yeah, so as I mentioned, this is obviously something we have a no tolerance approach to, and we've sort of taken 2 strategies to this. One is to help prevent this from happening in the first place, and then if this does happen, how we deal with it. So we've worked really hard with regulators, both in Guernsey, but then also across the UK to set really the gold standards with respect to clinical governance so that we put the appropriate checks and balances in place. So we require that we have to see a patient's GP records and or their specialist records to ensure that they're not only eligible for a medical cannabis prescription, but also they're a suitable candidate considering their entire history. And we also put, and if a decision is made that a patient is a suitable candidate for medical cannabis, we put, again, further checks and balances in place to ensure there are limits with respect to the amount of cannabis that a patient can request at any one time. And we also require that we see patients a minimum of 5 times in the first year of care, and then 4 times a year thereafter, through a mix of both telemedicine and in-person visits. And obviously, while I can't speak about specific cases for confidentiality reasons, for any individuals where we've been made aware of this, we've obviously alerted the appropriate authorities and also withdrawn access to care through Sapphire. But also, hearing the news from the police in Guernsey just last month, we'd obviously welcome a dialogue with them as well, so that we can work together to make that number as close to 0 as possible. Because we recognise that subversion of medicines, there is potential for that in any sphere of medicine. I mean, we had the Secretary of State for Health in the UK, Therese Coffey, just last month admitting to sharing her medications that she was prescribed with friends and family. And in any circumstances, that's not only illegal but poses a health risk to the individual who it hasn't been prescribed to. So we would very much welcome further dialogue with the police around that.
Relatively speaking, medicinal cannabis is quite a new thing, I suppose, in Guernsey. Have you, at your practice, seen an increase in the number of people from Guernsey seeking your services?
We have seen an increase. I would say it's slowly increasing over time. I wouldn't say that it was any sort of exponential growth or anything along those terms. And I think that's largely due to the fact that people are just becoming more aware of the fact that medical cannabis is an option for them. And in addition to the fact that obviously with some of the troubles with accessing healthcare in and around the COVID pandemic, as I mentioned, the conditions that we see are typically chronic physical and mental health conditions. And so there have been known examples where these conditions have been exacerbated through the pandemic, whether that be through, the isolation, reduced activity, but also through reduced access to care. So we're seeing more people with these conditions in and of itself as well.
Do you still think there's an element of stigma when it comes to medical cannabis, and a bit more perhaps work to be done? Perhaps maybe a reluctance among some GPs in the medical community to use it as to treat conditions, or do you think that is a hurdle that is being sort of stepped over as we move forwards, and it's becoming a bit more accepted?
Yeah, I think you're perfectly right there, Tim. I think it definitely has been an issue, but I think it's one that is slowly improving over time as we're able to provide more education to patients, healthcare professionals, in terms of what medical cannabis is, what it can be prescribed for, and really I do see that the stigma is reducing for patients all the time.
Dr. Erridge, thanks so much for your time this morning. Really appreciate it. That is Dr. Simon Erridge there, the Head of Research and Access at Sapphire Medical, which is a UK-based clinic that specialises in medicinal cannabis but serves patients here in Guernsey. So the question to you is, improper